Hi everyone, welcome back to another video. My name is Regine and I am here on this platform to provide guidance and support to independent contractors who are in healthcare, who are also either getting started or are already in the process. So I'm just here to share some tips based on experiences. And today's video is about finding opportunities as an independent contractor. So basically, how to market yourself or knowing where to market for opportunities. So, just to get started, knowing that it all depends on the type of service or services that you provide. As an independent contractor in healthcare, healthcare is huge. There are many different fields. There are doctors, there are mental health therapists, there are allied health therapists, and there's nursing, and there's like a plethora of other fields that are not clinical but is still considered part of healthcare. So this video is like a general is general in yeah, well, it's general. It's not specific to specific fields. So you can take these tips and kind of narrow it to what you do and try to figure out where does that fit in your field and where you can find those opportunities. And also, opportunities can also mean where your target audience is. And target audience means, in terms of healthcare, where your clients would be, clients or patients, depends on what it is that you do. So knowing where your clients would be or your target audience could be a possible setting or area to find those opportunities. So saying all of that, I will start with the first opportunity, which is signing up or try to get a contract with large agencies. And what do I mean by that? Based on my experience, I can only give you examples. I'll give you examples in terms of the experiences I've had. So, as an occupational therapist, I've mostly gotten opportunities in pediatric or with pediatric in pediatric centers or settings only because that's where my interest was. So if your interest is in adult, then that would be different. And so it depends on where you would want to serve or the population you would want to serve. That's where you would try to get those opportunities. So when I wanted to work in early intervention, I seek agencies that serve that population. When I wanted to work with agencies, and what I mean by that is having that third party in between. They have the contract from the city or the state. Well, in terms of early intervention, the state, and then they'll extend that opportunity to me. But as an independent provider or contractor, if you just want to be fully independent with no third party involved and you want to get that contract yourself, then of course you would go to that large state agency to seek that opportunity. Now it would be your responsibility to figure out how to get there, or how to get in contact with that agency or the department within that agency to get that started, if that's an option, because some agencies don't have that option for solely independent contractors, and some do. So that's one example of that. So just go find out with your target, find out which large agency support your target audience. And a way to tell is if that agency is the one funding the services that your target audience is receiving. So once you find that out, that's how you would know, okay, this is the large agency that I would need to find out if it is an option to give me a contract, if that's what I want, to target that same audience. Okay? And then if you're in nursing, then you would have to figure that out by following the same strategic moves. Okay? All right. So that was tip number 1. And tip number 2 is signing up with health insurance companies. That's if that's an option for you, because there are providers who want to service who want to serve, however don't want to be reimbursed through health insurance. Some want private pay, and well, basically private pay or a contract, and they don't want to get reimbursed through insurance. But if that's a desire of yours to get reimbursed through insurance, then that would be another option to find opportunities. And the way to find the opportunities is to basically know which health insurance you want to be credentialed in, and then proceed to do that. And then once you do that and approve and become a provider with that health insurance, your information will be listed in their directory. And when their members are looking for a provider, or you, the service that you're providing, let's say occupational therapy, physical therapy, speech therapy, or specialists, they would go to the directory. It's just the easiest way to find providers instead of using Google. You can use Google, but it takes much time, because sometimes when you Google give you whatever they want, and also it takes longer. So it's just a quicker way to, and most assured way to find a provider. And most members, that's the way they do it. They use the directory to find their provider. So and then saying that, you can get credentialed in anything. And a lot of times people who gets credentialed in health insurance is because they want to. There are many different reasons. It could be because they want to serve the underserved, because a lot of the underserved population do have insurance, and a lot of the underserved population have Medicaid and Medicare. And oftentimes providers do want to provide services or make themselves available to the population that is underserved, so they would accept Medicaid and Medicare. And so if that's an option for you to accept Medicare and Medicaid, and you're not yet enrolled in either or, and you want to get started and you don't know how to, that is a service I do provide. So feel free to reach out to me in the comment section, and I will gladly help you and support you with that and guide you on how to get started with it, okay? All right, so moving on to number 3. Number 3 is very, 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 very important. And then a lot of times people um, do that's like the old way of getting clients. Usually now we have many different ways of finding our clients. But the third way to find opportunities is to network. And networking means to just go out there and wherever uh, you think that your client may be, or wherever you think that um, whoever you think are serving your clients, and you just put yourself out there, you reach out and things like that, or you attend or you go in person and show your face and introduce yourself and share your marketing tools with them, and then that way you can get clients. And like for example, if you serve pediatric, right? And let's say, for example, early intervention. If I provide occupational therapy, I know I use occupational therapy a lot as an example, but that's because I've been in the field, so I know a little bit more about it, so it's easier to use that as an example. But if you have any questions regarding your field and when you're wondering where you can get opportunities, after watching this video you still have some more questions, you can also comment in the comment section, and I can share whatever I know. Okay, so let's say I serve the early intervention population, 0 to 3 at home. So that's early intervention. They push home therapy, and their ages are 0 to 3. And let's say I want to find opportunities. Let's say I'm already in their directory, my information is there, and I'm not getting enough clients, or I want more clients. So I want to take it upon myself and not leave it up to anyone to reach out to me. So what I would do is I would probably go to daycare centers near me, because early intervention is also provided in the community. And community means daycare, library, supermarket, the park, as long as it's something that the child is working on, it makes sense, it's okay. But there's, besides home, daycare is the number 2 option for treatment, because a lot of the children do go to daycare if they're not home. So you'll find a lot of therapists in daycare. So you can go in your area or the area you want to serve, and share your information with the daycare centers. You can do that. You can also go to community events in those areas. You can go to events that are catered to children 0 to 5. And then you can also make posts in the libraries. The libraries a lot of time have programs for children's younger children. They have a lot of programs with younger children. You could share your information with the library, and oftentimes they have a board you can put it up, or they can share it with the parents, however their rule whatever their rules are, that if they're open to it, then you can share it with them. And you can also share with wherever you think parents would be, parents groups, programs, like things like that. Um, the gym, a lot of parents, if the gym has daycare in the area, you can share wherever children are and parents are, and community events that bring out families are. You can share your information, and then you can also share your information in hospitals that are nearby. And what else beside hospitals? Hospitals, daycare center. Yeah, I think I covered most of those, the most frequent ones. Okay. Now, keep in mind, hospitals may bring you clients who are probably more physically, have more physical needs. So if that's part of the population you serve, fine, but just keep that in mind. Yeah, also keep in mind the population you're serving when you are reaching out, because if not, then you would have to turn them down because that's not the population you serve. So just keep that in mind. So if you serve, let's say, children with developmental delays, and that's your specialty, that's the realm you want to stay in. And keep in mind, if you go to the hospital is much more open to many different people with different diagnoses. So if they do reach out to you, they may reach out to you for other than what your service is. And so just keep that in mind as you reach out, and knowing where you want to put more of your energy than the other. Yeah, so yeah, those are the 3 tips I have for you today, in finding opportunities as an independent contractor in healthcare. If you have any more questions or any comments, if I leave out anything, or if you have any suggestions, any tips, other tips that I did not mention, please put them in the comment section below, or you could just say hi and let me know what field you are in. Are you an independent contractor, or are you starting as an independent contractor? Is it just an interest in the moment? Are you planning, if you are or not? Are you taking insurance? What kind of insurance you're taking? All that stuff. Like, just share with me, give me your input. And I want to thank you for tuning in, and thank you for watching the whole video. Please like, comment, and subscribe, and share if you know anyone who would benefit from this video. And I will see you on the next video. Okay? Bye-bye.